This is the Weiner Wellness Week 101, day one, Saturday. And how can we top this? We're going to kick the week off with the one and only Dr. Len Brancewicz, our partner in crime, all this past week.
Bringing back the Len and Joe
The
show.
Len and Joe show, part two. Stay tuned, folks. It will be resurrecting. Is that the right word to use? Resurrecting the Len and Joe show one of these days. But for now, today, you get the man, Dr. Len Brancewicz.
Thank you, Joe. I appreciate it. And welcome to you all. Thank you so much. I look at my career, which is now coming on year 38, and the fact that I am now sitting here in a teaching mode, which is what I really love to do. And Jamie gave me the challenge of trying to come up with how do you resurrect, I guess is the word, or how do you transition, or how Jamie has it, what is the evolution from traditional medicine, allopathic, to a more holistic view called a naturopathic approach? What is it? And if we're going to do this correctly, and we're going to try to come up with some ideas, you got to understand something. Why would you want to do that? First of all, why would you want to transition from a pharmaceutical to a nutraceutical unless there's something wrong with that system? So the first thing we have to ask ourselves is, what's wrong with traditional medicine? And we were talking earlier, I was talking to a few of the people here at the Wellness Week about looking at the prices of supplements and the fact that you come down here to take advantage of sales and all the different products that are put here in front of you. And you realize one very important thing: this isn't covered by insurance. So when you look at what's wrong with the allopathic model, what's wrong with the traditional model, first thing we have to say is it's being completely governed by insurance. So if I can get it, and I can get it for free, I'll use what I can. And there's nothing wrong with that. That traditional model, which is where I've been trained, where I come from, my pharmacy background, my oncology background, that's where I worked. And I worked there for decades, actually. So I knew that part of medicine inside and out. And it took a lot for me as a practitioner, as a patient, to make that transition to a more natural approach or a nutraceutical approach. And I'll just tell you real quickly my story. Being a medical practitioner, I didn't go to the doctors. I didn't feel I needed to go to the doctors. I could take care of myself. And I went for my first real physical at age 39. I went in because it was for an insurance company. They wanted an insurance policy to make sure they can insure me. So I went in and had all the blood work done, all the testing done. And in the midst of this, I found out a diagnosis of rather serious cardiovascular disease. I had the beginning stages of an aneurysm on my abdominal aorta. And it was, I guess you call it a coming to Jesus moment to say, how could I? I ate right. I knew what I was doing. I was working out. I was probably in the best shape of my life. How could I have had serious cardiovascular problems? Well, in the midst of that, I started down the traditional allopathic manner. See this? This is a prescription pad. Inside of there were prescriptions. So when I sat down with my doctor for some advice and I said, hey, doc, could you help me here? I have cardiovascular disease. How can I make it go away? Took out the prescription pad and wrote me 6 prescriptions. Not 1, not 2, not 3, but 6. Now, being a pharmacist, I knew what they were all for. And I was trying to piece together in my mind, what would make this actually make this problem go away? Or was I just throwing something at it, trying to make it just be temporarily down? So I decided I'll try this approach. And for the next 6 months, I took 6 prescriptions every day. I'm not going to go into what they all were, but one of the major ones was 2 different statin drugs to lower cholesterol. Well, in the meantime, 3 months into this regimen, I was getting my hair cut one day, and I was looking in the mirror, and the barber was getting ready to cut my hair, and that's the last thing I remember. I woke up in the emergency room. I had a seizure, and they kept me in the hospital for 5 days to try to figure out what the seizure was being from. They couldn't figure it out. They sent me on my way. 2 weeks later, I had another seizure. Went back into the hospital for another complete workup. shaved my head, put EEGs in my head, trying to figure out what was causing this. You know what was causing it? The pharmaceuticals. It came to the conclusion that the 6 medications together were causing such a serious interaction that I was causing me bigger problems than what I started with. So I said, okay, I got to draw a line in the sand and say, I either take these medications, which they tell me are going to do something, or I have to start studying. And that was the start of me at age 40 going back to school. For 19 more years, I went back to school. I was becoming a student again. I was going to learn all the techniques. I went for clinical nutrition. I got board certified in there. I went to the British Institute of Homeopathy. I tried to find out, could homeopathics help? Then I went for my naturopathic medical degree. I was going to go for an ND, naturopathic doctorate. I decided to go for an NMD through Johns Hopkins. I wanted a more traditional approach again. I wanted to know. Finished that, took care of myself, and now I have myself to the point where the abdominal aorta problem is gone, my cholesterol problem is gone, and I'm not on any pharmaceuticals at all. So it took a while, and during that time, I started to learn more and more about what could be done. So when Jamie asked me and said, can you teach individuals? What did you just do? Well, I said, well, I went back to school. Not everybody can do that. So what is the protocol? What do you do? So I decided to go back to the books and take a look again to say, if you're going to do this, you have to first admit that there's something wrong with this traditional model. There's something wrong with pharmaceuticals as a whole. They're life-sustaining. They can save your life, but there could be some problems there. So I went out and interviewed doctors, and I pulled a lot of research pieces to say, if they are running the ship, if they are the ones, these traditionally trained allopathic doctors are the ones that are training us and going to treat us, I have to know something. So we did a survey, 11,000 doctors. And what we found was, and I got the results right here, 82% of those doctors said they were overworked. 91% said they were underpaid. 96% say they didn't have enough time with their patients because of insurance regulations. 97% said they feared missing the mark. And that's an interesting category, is that they had this fear factor in the back of their mind that were they prescribing accurately for you? Or could they be missing something? And then 98% of them said, if you took away my prescription pad, I haven't a clue what to tell you. So that being told, we went back to the doctors and surveyed them again and said, now, you've got the wellness center here. You've got hundreds and hundreds of different supplements. Dear doctor, do you want to learn a little bit more about this? Could this be something that is in your wheelhouse? Could you actually learn how to do this and maybe not rely so heavily on this? Now, in the meantime, I came across a book and I started sharing this with doctors because time seemed to be a big issue with them. So this is a book that I carry with me all the time. It's by John Mark Comer. It's called The Ruthless Elimination of Hurry. And when I find myself chasing time, I find myself running around trying to get something accomplished and I'm not making it, I read through this book and I find some amazing things. And one of those that I came upon just this morning, said a recent study found that the average iPhone user, touches his or her phone 2,617 times a day. Each user is on his or her phone for 2.5 hours every 48 hours. And the similar study found that just being in the same room with your phone, even if it's turned off, reduces your working memory and your working skills. So if we could say, first of all, as a patient, and I want to transition from this allopathic model into a nutraceutical model, what do I have to do? The first thing we have to do is eliminate the hurry out of your life. Let's settle down. Let's focus. Let's concentrate. Now, I have in front of me an article that I'm just going to quote from. This is from a journal called Clinical Pharmacology. I get this journal. It's not for everybody. It's a boring thing they send out to pharmacists. And in it, this last November, they said, from pharmaceuticals to nutraceuticals, bridging disease prevention and management. from a pharmacy perspective, they're now saying that if we really want to prevent disease and we want to manage disease better, we better look at the nutraceuticals and assuming and making that these things actually do work. This is what they said. Nutraceuticals, everything that we see here, up to today, do not have a specific definition distinct from those of other food-derived categories. Food supplements, herbal products, probiotics, prebiotics, functional foods. They do have, however, pharmacological benefits and have a major effect on health. Many studies have been recently addressed to assess their safety, efficacy, and regulation since they're getting a growing attention. They go on to say, it is of utmost importance that we as doctors have a proper and unequivocal definition of nutraceuticals and use them as a shared product. Nevertheless, there's a lack of clear information and claimed health benefits may not be properly substantiated. So they went down and they gave the big butt at the very end of this to say, okay, we understand these things are out there, but do we really want to know? So again, we asked doctors, hey, doc, let's talk about this. Would you like to know how we do this? You're going to hear case studies coming up at 12 o'clock today. Some actual testimonials of things that have been accomplished, which I'll be honest with you, blow me away at times. When I've seen case studies of people turning around things from as serious as stage 4 cancer to Parkinson's disease to Alzheimer's and getting stabilization just by using some very simplistic, targeted approaches. So again, when we ask the doctors, hey, doc, do you want to know more about these nutraceuticals? Would you like to learn a little bit more about these nutraceuticals? 97% of them said, no, not really. And when we asked the question, well, why? Because I don't have the time to learn. So would you like to learn, doc? And the bottom line is, I took the results of that survey and gave it to Jamie here. And I said, if you ever needed an attribute to say, this is why everybody here at the Wellness Center is so intimately involved in teaching patients, teaching clients, teaching other doctors. We just got back from a conference in Akron, Ohio. Next week, I'm going to be teaching in Atlanta, Georgia. We're talking to traditionally trained doctors. We're going out into the field, recruiting doctors to come in and say, hey, doc, give us an evening. We'll give you a meal. We'll sit down and we'll teach you what you need to learn. So that's been my new passion. You know, Jamie pulled me out of retirement. I moved to Florida 2.5 years ago to just sort of wind things down. But my wife just keeps telling me, go with Jamie and go get out of the house and go teach someplace, which I do. She's very traditionally trained as well, physician assistant. So when we look at this, and I want to go into a very interesting piece that I'll bring up here that says, this just came out in January of this year. Appropriate prescribing of medications, an 8-step approach. This went from the American family physician to every physician in this country. I'm just going to highlight a few of the things. It says, number 1, evaluate the person's problem. Clearly define the patient's problem. And when we go out, whether it's here at the Wellness Center and they're going to sit down with you and say, I've got diabetes, what's your protocol? We can have a protocol. We can have something that has specifically been tried and true. But once again, you have to evaluate and clearly define what's going on with that patient. There may be something different. Is that patient of normal weight, overweight, underweight? Is that patient 30 years old or 90 years old? You have to be able to define where exactly that patient is in the walk so that you can properly take care of that problem. Step number 2, specify your therapeutic objective. What do you want to do? Is it going to be this pharmaceutical prescribing? Is that in your mindset and you're in your mindset only? Is this the only thing you're going to do? Because if it is, you have to stop at number 2. Step number 3, select the appropriate drug therapy. If in your mind, in your training, it said, I need to use hydrochlorothiazide for a water pill. Do you know what the side effects are of that? Do you know the nutrient depletion factor of that? Is there any other alternative to that, or are you going to go there first? Step number 4, initiate therapy with appropriate details. Step number 4, every doctor, consider first non-pharmacological therapies. Doctors have been instructed, before you do this, before you start writing scripts, consider everything else that's out there. Step number 5, give information, instructions, and warnings. Number 6, evaluate how well the therapy worked. And lastly, consider drug cost when prescribing. That's relatively new. Very rarely have doctors ever come to the conclusion that cost is going to be a predicating factor. Although, when you look at the new cost of drugs, and I don't do a lot of that anymore, but when I see something like an albuterol inhaler that I used to sell in my pharmacy for $9 is now close to $200 in a very short 15-year window, there's a problem there for pricing. Now, the next thing I want to do before I go into some of the other concepts here, and we're going to try to keep this quick, is when you look at everything that's here, when you look at every nutraceutical that's back there, and you look at the basis of nutraceutical use, why do you take oranges? Why do you take net zero keto? Why do you take glucolize? Any of the products are out there. The primary purpose is to reduce what's called reactive oxygen species. Our human body, as God created us, tends to rust out. We tend to have damage from things we're exposed to. You look at what just happened in Ohio, in East Liverpool, and the toxicities that were released and the number of reactive oxygen species that are going to take place in the human body. The analogy that I was taught when we were in med school about reactive oxygen species is that it's something that once you light the fuse in the human body, it spreads rapidly and it causes destruction. Look at, let's say, a car door that may get the paint chipped off and all of a sudden it rusts out. That rusting effect can take place in the human body. You know, when I turned 70 years of age, you start to notice age spots creeping up. It's called lipofuscin. It's called cellular rust of those parts of your tissue. You know, a lot of people get that easy bruising on their skin, cellular rusting. This is an article and a little chart that we put together, and I'll make copies of this and leave it here. But when you look at reactive oxygen species and you look at, if I was going to do one thing in this transition from pharmaceuticals to nutraceuticals, and I did something like Power Cleanse, and I just decided I'm going to do that in the greens. The only thing I'm going to do that once a day. And I'm going to feed and quell reactive oxygen species in the body. Here's just a list of where reactive oxygen species can damage: gastrointestinal problems, hepatitis, liver injury, eye problems, cataracts, retinal damage, skin, dermatitis, heart attacks, joints, arthritis, lung, asthma, brain trauma, stroke, multi-organ failure and cancer, vessels, atherosclerotic plaque, vasospasms, dental problems. There's not much more beyond that cannot be quelled by going into reactive oxygen species. So now here's an article that I'm going to close with today and give you just a few tips. This is what we've been teaching the doctors. We wanted to go back to traditional journals. This is from the International Journal of Preventative Medicine. And we wanted to say, if there are acceptable diagnoses that medicine has linked that said these are the ones that you should not prescribe for first, these are the ones that you should look to an alternative form of therapy for. So, number one on the list, I'm just going to go through these quickly. Number one, it says recently published papers about different aspects of nutraceuticals as alternatives for pharmaceuticals were searched using scientific sites such as Medline, PubMed, Google Scholar. The used terms include nutraceuticals, and it goes through a whole list. Number one, it should be addressed by some nutraceuticals before you start prescribing. Allergies, hypersensitivity disorders, and they talk in here about the use of vitamin C, quercetin, and in this case, you look at the number of different nutraceuticals that can help with allergies. You're going to hear more about that with Mikey at 1 o'clock today. Number two, the fastest growing disease state in the United States right now. You know what that is? Alzheimer's disease. If you go back 10 years ago, it was hardly heard of. Now it's been listed as the number 6 cause of death in the United States. It's growing faster than any disease state. Why? Cellular rust to the brain. This article says before you start prescribing, and when you look at what's actually come out of the pharmaceutical industry for Alzheimer's, nothing's really worked. They use a form of medications called acetylcholinesterase inhibitors that by their very own literature is only about 37% effective in trying to stabilize. Number 3, this goes back to my original story, cardiovascular disease. Before you start down the prescription world and you have somebody in the early stages of cardiovascular disease, plaque buildup, had a heart attack, had a stroke, look at nutraceuticals first. Do something to support the system before you start prescribing. Number 4, this one shocked me that it made the list. Cancer. Cancer. This is where I worked for the first 6 years of my career. And to this day, I get into a few, and I won't even call them arguments with oncologists, because the most common thing we see when a person's diagnosed with any stage of cancer is the oncologist says, stop, you can't take anything. This article says, cancer has emerged as a major public health problem. According to the World Cancer Report, cancer rates are increasing. 15 million new cases in 2020. 21 million new cases in the United States. 21 million cases last year. Our population is 330 million. 21 million cases of cancer last year. And I think we all know of somebody, a friend, a relative, somebody that's been recently diagnosed with cancer. This article says, the use of the proper forms of nutraceuticals, especially for liver cancer, colon cancer, lung, breast, stomach, or esophageal cancer, should be your first run before you start down the chemotherapy run. Next, diabetes. Diabetes is the number 1 fastest growing disease state in this country, primarily due to the obesity epidemic, blood sugar irregularities. They're saying, again, the most common form, type 2, it develops with 95% prevalence with people that are overweight. It says, before you jump onto a pharmaceutical like metformin, consider all the alternatives. Teach a person how to eat properly using specific drugs, specific nutraceuticals like glucolyze. Number 6, eye disorders. When you're looking at, and this is probably one that I think we've all been exposed to, when we've gone, had an eye exam, they do a glaucoma test, maybe we have floaters. There's a lot of different things that are out there. And most commonly, we prescribe something, another eye drop or some other form. This article says using medications, nutraceuticals like lutein and astaxanthin and some of the things that are in like the Prep 2020 should be your first run. And you should give it enough time to see if it can make a substantial difference. Next was your immune system due to COVID-19. Once again, when you look at everything that was out there, and now that the smoke is clearing, and we said masks didn't do anything, closing the stores didn't do anything, closing the schools didn't do anything, and most of those pharmaceuticals that we came up with had very little effect actually. But when you look at it and you said the things like zinc and buffered vitamin C had a much more major effect on controlling things like COVID than anything else that was offered. The biggest research piece that's come out right now is about the SPMs, specialized pro-resolving mediators, actually been used in Europe through the whole COVID outbreak of knocking that virus out of the system in as quickly as 4 days. So it can be used at a very high dose and can actually take that virus out of the system. If anybody's not aware of SPMs, I encourage you, if you just do a Google search and just type in the word SPM and put a disease state next to it, SPM's glaucoma, SPM's cataracts, SPM's cancer, SPM's COVID, SPM's diabetes, you will find there are close to 16,000 published studies right now on SPMs. Nutritional Frontiers is one of the only ones that's had the true German form. Next is inflammation. And again, this goes hand in hand with SPMs. Inflammation is something that has been linked ever since 2002 to every disease state known to man. If we have inflammation, we're going to have some sort of a disease problem. How do you lower inflammation in the body? Use of fish oil, use of buffered vitamin C, but in this case, SPMs have worked dramatically. Two more to talk about. One is Parkinson's disease. And again, we've known that Parkinson's disease is now the 7th leading cause of death in this country. Parkinson's disease, if you go back just as little as 5 years ago, was hardly seen. It is one of the fastest growing neurological problems in this country right now. If you have a chance to go to the Nutritional Frontiers website and go under the testimonials, and there is a video there published. It was done on YouTube, started in 2018, about a fellow just north of here in Edinburgh, had Parkinson's for 8 years. Could not balance on one foot, which is a very distinctive sign. Could not move his arms side to side, very distinctive sign. And hadn't ridden a bicycle in almost 20 years because Parkinson's patients can't balance. We used a very aggressive therapy protocol with him, using a high dose of CoQ10 and some of the hemp extracts. And this fella, in as quick as 4 days, started turning around, and at 14 days was out riding a bicycle. And now we're literally 3 years back. He's been completely stabilized. So it's possible. These things, we got to be very careful about making claims, but there are so many different protocols out there that can make a biggie. And lastly is obesity. Since it is the number one cause of problems in this country, what do you do? How do you stop people from overeating? How do we stop them in getting quality in their diet? How do we get them to start eating correctly? And that's the world that we all have to live in, that we have to work with individuals to do that. But there are so many different keys that can easily make a difference in a patient with obesity. We did a 90-day study using simply, again, the Power Cleanse and the greens every morning. And we put the patients on a 21-day solid 24-hour fast, 1 meal a day for 21 days, 1 meal at dinner time. We had no breakfast. We had the shake for breakfast, no lunch, and we ate a well-balanced meal for dinner. And we did that. And we took a 24-hour fast till the next day. We did that for 21 days by integrating the Power Cleanse in the morning to get all your nutrient factors and really help you from getting hungry. We showed a 13% weight loss in the first week. We showed at the end of the 90-day period anywhere from a 30 to 31% weight loss. And that was without very difficult restrictions on diet. So, yes, can it be done? Yes, it can. So, in the world of transitioning from allopathic to nutraceuticals, my key takeaway message is do it very carefully. Get with a practitioner that knows what they're doing so that they can make the distinctive changes for you and walk you through that. Get hand in hand with your doctor so that we can get to the point where he or she can see the differences in you so you can make the change. Once again, in that interview that I had with the doctors, their most common comments about nutraceuticals is, I don't know, I don't want to know, it's easier just to say no, I can't control it, and lastly was quality control. They were concerned about the quality of the supplements. In my 38 years, Jamie and I go back about 25 years. When I had my offices, I carried every single supplement line there was. And when I started to go around to various manufacturers, watching how they put together nutraceuticals, and I will go to one in particular that was based here in Pittsburgh, and I went into their drug room when they were starting to get the raw materials in, and I saw virtually every container have Chinese writing on it. And I said, I watched what happened when Chinese dog food came in, and I watched when Chinese this came in and Chinese that. And I said to Jamie then, if I'm going to use and dedicate myself to a line that I have to know about quality, I said, you have to be my backup on this. I want made in America. I want American raw materials. I want American grown sources. I want to know. And everything from fish oil down to your protein powders. And that's what he's given me over the last 38 years. So when you look at quality, there's a lot of good companies out there, but I haven't seen anything that can touch base with what they're doing here at Nutritional Frontiers. You want to talk to somebody, call and schedule a time, get together with somebody. They can put you in contact with me if necessary. You want to make that transition, it can be done. It's just going to take a little bit of work, a little bit of time, and the dedication from you. Okay? That's what I got for you today.